Hello. So approaching journal for week number 2, an issue that I come across currently or frequently as a nurse and then carrying over into the role of a psychotherapist is um, I'm 43, almost 44 years old in a couple of weeks. And a lot of the patients that we get here are middle-aged or older, and there's always an automatic assumption that I'm younger than I am, or that I don't necessarily have any life experience, usually on the part of the patients, and they will a lot of times vocalize it. And it's easier for them to vocalize sometimes because there is the psychotherapist in the room with me that is my preceptor, who's 20 years older than me, so they will make a statement like, well, I expect you to understand, Dr. Singer, because you're older, when a lot of the times I am the same age or maybe an older a lot of times than the patient. And so there's that automatic judgment that I just don't have the life experience or age or maybe wisdom or whatever it is to be able to help them effectively in whatever situation that it is that they're in. There's different ways or approaches that I've gone about that. Sometimes I will casually or in a kind of disguised way insert my age into a conversation, just to let them know maybe I'm not as young as they necessarily think I am, or just interject, if it's relationship troubles that they're having, that I've been married for 22 years, things like that, just to kind of give them that comfort level. But then there's also the understanding that we aren't always going to necessarily walk through the same types of struggles that our patients or our clients do. And that's not always necessary for a psychotherapist or provider to have experienced those same types of hardships or troubles for us to be an effective caregiver for them. Now, it is important that we've read up on or we have some knowledge base when it comes to things that they may be struggling with, so that we can point them to resources or that we understand maybe the disease process that they're going through. But it's not necessary that we have experienced the same things that they are necessarily experiencing in life. So it isn't necessary to always say, hey, I do know where you're coming from, or we don't even necessarily have to open up and say I can identify from my own personal perspective, although a lot of times they do appreciate that. But we have to be careful about that in general, just as psychotherapists, but and just to be guarded with that in general. But it is hard for me just in general, in that I'm almost a lot of times immediately written off as having limited life experience, because for whatever reason they automatically assume that I'm a lot younger than I am necessarily. And so that is an issue that I do feel like I run across. And so I do feel like it is appropriate for me to continue in the relationships with those patients, because I think over time they can just begin to develop trust as they see that my perspective is a little bit different, or maybe more open or aligned to maybe what they were looking for. So again, I think the key is just continue moving forward. And if you see that that trust relationship just can't be developed, then that would be a time to maybe decide that it's not best to continue in the relationship, but at least make the attempt. So thank you very much, and I will see you next time.